NCLEX RN practice questions free. Question 1. Set 1. Which medication is used to treat a suspected opioid overdose? Naloxone, flumazenil, atropine, epinephrine. Naloxone, Narcan, is an opioid antagonist. Question 2. Set 2. What is the primary characteristic of anorexia nervosa? Binging and purging, distorted body image and self-starvation, excessive sleeping, fear of spiders. Anorexia involves a refusal to maintain a healthy weight and a distorted perception of one's body. Question 3. Set 3. Which condition is characterized by currant jelly, stools, celiac disease, intussusception, Hirschsprung's disease, Crohn's disease? Intussusception causes stools mixed with blood and mucus, appearing like currant jelly. Question 4. Set 4. A patient is taking warfarin. Which lab value should be monitored? APTT, point/INR, platelets, WBC. Point/INR is used to monitor warfarin, Coumadin, therapy. Question 5. Set 5. Which electrolyte imbalance is associated with Trousseau's sign? Hyperkalemia, hypocalcemia, hyponatremia, hypermagnesemia. Trousseau's and Klostek's signs indicate hypocalcemia. Question 6. Set 6. What is the antidote for heparin overdose? Vitamin K, protamine sulfate, naloxone, acetylcysteine. Protamine sulfate neutralizes the effects of heparin. Question 7. Set 7. A client is diagnosed with peripheral arterial disease, PAD. Which symptoms should the nurse expect? Dependent rubor, painless ulcers, bilateral edema, warm skin. Dependent rubor, redness when legs are down, is a common sign of PAD. Question 8. Set 8. What is a classic sign of appendicitis? Left upper quadrant pain, rebound tenderness at McBurney's point, pain relieved by eating, hematmesis. Pain in the right lower quadrant with rebound tenderness, McBurney's point, is classic for appendicitis. Question 9. Set 9. Which type of immunity is gained after receiving a vaccine? Natural active, artificial active, natural passive, artificial passive. Artificial active immunity results from vaccination. Question 10. Set 10. What is the therapeutic level for lithium? 0.1 to 0.5 milliequivalent/L, 0.6 to 1.2 milliequivalent/L, 1.5 to 2.5 milliequivalent/L, 3.0 to 4.0 milliequivalent/L. The maintenance therapeutic range for lithium is 0.6 to 1.2 milliequivalent/L. Question 11. Set 11. Which insulin is considered rapid-acting? Lispro, NPH, Glargine, regular. Lispro, Humalog, is a rapid-acting insulin with an onset of 15 minutes. Question 12. Set 12. What is a major safety risk for toddlers? Sports injuries, poisoning and drowning, occupational hazards, elder abuse. Toddlers are at high risk for accidental poisoning and drowning due to their curiosity and mobility. Question 13. Set 13. Which position is best for a patient receiving a tube feeding? Prone, supine, high Fowler's, left lateral. High Fowler's position prevents aspiration during enteral feeding. Question 14. Set 14. A nurse is caring for a patient with neutropenia. What should be avoided? Hand washing, fresh flowers and raw fruits, wearing a mask, high-calorie foods. Fresh flowers and raw produce can harbor bacteria and fungi, posing a risk to immunocompromised patients. Question 15. Set 15. What is the diet recommended for a patient with diverticulitis in the acute phase? High fiber, NPO or clear liquids, high fat, low protein. During acute diverticulitis, bowel rest, NPO or clear liquids, is necessary to allow inflammation to subside. Question 16. Set 16. What is the primary goal of care for a patient with Alzheimer's disease? Curing the disease, maintaining safety and function, improving memory, teaching new skills. Management focuses on safety, nutrition, and maintaining the highest level of function possible. Question 17. Set 17. A pregnant woman is at 32 weeks gestation. Which sign should she report immediately? Leg cramps, blurred vision or headache, backache, frequent urination. Blurred vision and headaches are signs of preeclampsia. Question 18. Set 18. A patient with alcohol withdrawal is tremulous and agitated. What medication is usually prescribed? Disulfiram, chlordiazepoxide, methadone, bupropion. Benzodiazepines like chlordiazepoxide, Librium, are used to manage alcohol withdrawal symptoms. Question 19. Set 19. A patient is scheduled for surgery. When should the consent be signed? In the OR, after the sedative is given, before any preoperative medications are administered, in the recovery room. Consent must be signed while the patient is alert and not under the influence of mind-altering drugs. Question 20. Set 20. A patient with DKA has Kussmaul respirations. What is the physiological reason for this? To retain oxygen, to blow off CO2 and correct metabolic acidosis, to decrease blood pressure, to increase intracranial pressure. Kussmaul respirations are deep and rapid to compensate for acidosis by removing CO2.